Stakeholder Education Plan. Hello, everyone. My name is Marlita Bates Castillo. I work as a hospice and public health nurse for 24 years, and I believe I have a wealth of professional experience in my field. I am currently employed as an adult geriatric hospice nurse practitioner. Today, I will present my evidence based project on the impact of dignity therapy intervention on the psychosocial distress of patients receiving end of life care within 6 weeks. This clinical scholarly project is aimed at offering dignity therapy treatment to terminally ill patients who have 6 months or less to live and are admitted for end of life services in hospice care facilities. This project will also provide insight into the lesser discussed aspects of the peaceful end of life services provided in hospice care facilities and their positive effects on patients' preconceptions of death. Furthermore, stakeholders are essential in individuals who must be considered and given importance for the implementation to succeed. Terminally ill patients aged 50 and older in a home care facility and the respective healthcare providers are considered stakeholders in this project. Both are expected to collaborate to achieve the desired output and the expected environment following this intervention. Training sessions for healthcare providers administering dignity therapy techniques are required for the project's successful implementation. Sufficient knowledge of the various questionnaires to be used must also be highlighted. Patients should be educated on the importance of this type of session for relieving their burden. This is to ensure that they cooperate completely throughout their treatment program. Dignity therapy was initially developed to help patients cope with the impending end of life by addressing the sources of psychosocial and existential distress. This intervention helped to preserve the dying patient's dignity. The significance of dignity therapy was based on dying patients' self reported notions of dignity. It addresses their need to feel that their lives have meaning and live a sense of self with loved ones after they die. It assisted patients in reconnecting with the accomplishments and experiences that made them unique and valuable as people. Cuevas et al. 2021. Thus, a well trained healthcare provider will get the desired result from the therapy. The model of dignity in the terminally ill patient, or the MDTP, and the Schwartz theory of values will serve as the theoretical foundation for this project. The MDTP describes three significant factors related to patients' perceptions of lost dignity: illness related concerns, which are concerned with the consequences of one's physical and psychological condition; dignity conserving repertoires, which are concerned with the psychological and spiritual dimensions of one's life; and the social dignity inventory, which reflects the social and relational dimensions of one's life. This project considers dignity a function of the values participants have cherished throughout their lives. It is based on Schwartz's theory of values, which describes the principles guiding people's behavior as desirable and as situational. One's sense of dignity can be viewed as a fundamental value influencing all aspects of one's personality, and that is according to Testoni et al. 2020. The two theories mentioned above will serve as the foundation for a more in depth understanding of this innovative project's framework. Furthermore, as illustrated in the system thinking map, the conceptual framework will revolve around input, throughput, output, and feedback. According to the project's implementation plan, the identified information is to provide high quality end of life care. Patient and family centered care has emerged as an universal ideal for end of life care services. The throughput will be dignity therapy interventions completed in 6 weeks. This project also observed a significant decrease in psychosocial distress among patients from pre-treatment to post-treatment. The level of satisfaction among patients and family members will be used to collect feedback. The effectiveness of the intervention will be assessed using death and dying distress scale. That means call it as DADS. It is a practical death anxiety measure with high reliability and validity that could be used in research and clinical practice. This scale has benefits since the items are focused on death and dying distress with no specific scenarios, which are beneficial for generalizing usage among patients with limited lives, according to Tang et al. 2021. This project is undeniably relevant to the healthcare system as the number of terminally ill patients increases. Hospitals and hospice care facilities must provide innovative end of life care that promotes high satisfaction. According to a study, dignity therapy scaled back distress significantly and was a therapeutic tool for sustaining a sense of peace in terminally ill patients, according to De Vicencio et al. 2023. Dignity therapy may assist end of life patients in reducing psychological distress manifested as hopelessness, helplessness, depression, diminished dignity, a loss of will to live, or a desire to die. It employs interviewing, recording, and logging methods to create a generativity document passed on to the patient's family or relatives. The patient's sense of self-worth and dignity is enhanced during treatment, and psychological distress is reduced, according to Lee et al. 2022. Based on the discussion presented, this project is expected to reduce the number of terminally ill patients experiencing psychosocial distress and create a peaceful, conducive environment that encourages innovative, cost effective treatment intervention. I believe that dignity therapy is effective modality in the end of life phase of a terminally ill patient. It is unique, non-invasive and practical way that can benefit the patient in their terminal stage of life. Dignity therapy offers an opportunity for the patient to express about things that matters most as well as aspects they want to remember as their legacy and self-worth. Thank you for listening.